Transcranial direct current stimulation, or TDCS, and schizophrenia. Schizophrenia is a psychiatric disorder characterized by hallucinations, delusions, disorganized speech, decreased motivation, and by cognitive deficits involving impaired executive functions, memory, and speed of mental processing. Persons with schizophrenia have lower grey matter volumes and fewer dendrites and dendritic spines. Interestingly, among persons experiencing psychosis, there is a greater rate of grey matter loss over time in the prefrontal and parahippocampal regions. These structural features are hypothesized to contribute to altered physiological activity and functional connectivity among the prefrontal and temporal cortex, thalamus, hippocampus, and cerebellum. Tdcs has been proposed as a non-invasive and effective treatment for schizophrenia. Tdcs induces a weak electric current that flows from the anodal to cathodal electrodes placed on the scalp. It is thought that anodal stimulation increases cortical excitability, whereas cathodal decreases it, causing the depolarization and hyperpolarization of neurons. Interestingly, it has been observed by Jerome and colleagues in 2014 that using TDCS on schizophrenic patients seems to reorganize the neural network underlying the symptoms of schizophrenia. A study on 30 patients with the condition produced some promising results, with the anode placed over the prefrontal cortex and the cathode over the left temporoparietal junction. Reductions in all symptoms were reduced. A reduction of 31% of auditory hallucinations was recorded, with a 12% reduction of general symptoms of schizophrenia recorded. After careful comparison between before and after scans of the patient's neural networks, it was confirmed that there was a significant reduction in connectivity in language-related brain areas, and a reduction of connectivity between the temporoparietal junction, the prefrontal cortex, and the inferior frontal gyrus. Similar, it was observed that when TDCS with the cathode of the left temporoparietal junction and the anode placed over the left dorsolateral prefrontal cortex led to decreases of severity in hallucinations, increased self-recognition in patients, and the functionality of the temporoparietal junction. There was a correlation between the decrease in severity of hallucinations and the decrease of functional connectivity. There was a correlation between the decrease in severity of hallucinations and the increase in source monitoring performance. These results suggest that TDCS may have resulted in clinical improvement in functional connectivity within a large network of the brain involved in language and self-recognition processing. Similar, an older study showed positive results when administering just a single dose of TDCS on 2 schizophrenia patients, with results withstanding for as long as 3 months. In this study, bifocal stimulation improved scores on measures of auditory hallucination and overall positive and negative symptoms. However, with such a small sample size, the study's results have lowered external validity to the general population. The same study with a larger sample size would be a more efficient way of determining the reliability of the results. Other studies have found disappointing results when examining the effects on auditory hallucinations in schizophrenia patients. In one study by Chang and colleagues in 2018, which was conducted on 60 patients with hallucinations, it was concluded that with anodal stimulation to the left prefrontal cortex and cathodal stimulation to the left temporoparietal junction, it failed to produce any significant effects on hallucinations and other negative symptoms. Some studies have also produced no significant effects whatsoever. A study by Rosovsky 2018 containing 37 participants examined the effect of single-dose Tdcs on social cognitive and non-social neurocognitive functions, which produced no effect. However, evidence suggests in most cases multiple sessions of Tdcs is the most effective in producing results, and one-dose sessions may not be enough to produce any substantial effects. Further, other studies have also reported negative findings. In 2 randomized controlled trials, the effects of anodal stimulation to the prefrontal cortex and cathodal stimulation to the temporoparietal junction in patients was examined. It was reported that neither procedure resulted in a substantial change in symptoms among patients. While some of the results may be promising, much future research is needed to conclude the efficacy of Tdcs on schizophrenia. This method of treatment is one of the lesser investigated methods and will need much further research. Suggestions for further research include larger sample sizes and more randomly selected participants in trials for better reliability and external validity. Further, more research on the physiological effects of Tdcs has on the schizophrenia brain would be extremely beneficial in understanding the full extent of effects of the treatment.